Over the past few weeks, we have been building the science behind Prasad, one step at a time. First, we discussed who Prasad is designed for. Then we explored why an arthritic knee never truly stops being inflamed, what stem cells actually do, and what keeps the inflammatory alarm switched on inside the joint. Today, we complete that story because understanding who should receive a treatment is only half the story. Understanding who should not receive it or who should wait is just as important. Any treatment that claims to work for everyone is usually not being honest about its limitations. Good medicine has boundaries, and respecting those boundaries protects patients. I am Dr. A.K. Venkatachalam. After 4 decades in orthopedics, I have learned that sometimes the most important treatment decision is knowing when not to treat. Today, I'll explain why. The first exclusion is structural. Many people believe every grade 4 knee needs replacement. That isn't true. Equally, not every grade 4 knee can be preserved. An X-ray tells only part of the story. We evaluate the entire joint, its alignment, its stability, the remaining cartilage, the condition of the bone beneath the cartilage, bone marrow changes, the surrounding soft tissues, and most importantly, your biological ability to heal. When the joint has completely collapsed, when there is major deformity, gross instability, or irreversible structural failure, biology alone cannot reliably rebuild that framework. Prasad is a joint preservation protocol. It is not intended to replace reconstructive surgery when the mechanical architecture has already failed. Our responsibility is not to avoid surgery at all costs. Our responsibility is to recommend the treatment that gives you the greatest chance of success. Sometimes the treatment is Prasad, sometimes it is surgery. The second exclusion is metabolic, uncontrolled diabetes, persistently elevated HbA1c, poor metabolic health. Prasad depends upon your own biology. If that biology is unhealthy, the treatment starts at a disadvantage. High blood sugar damages collagen.
In high-sugar environments, glucose molecules attach to healthy collagen, creating stiff, brittle networks.
Promotes chronic inflammation and interferes with tissue repair. Imagine trying to build a house while someone quietly removes the bricks every night.
We built it up, but they remove the bricks every night.
That is what uncontrolled diabetes does to healing. Notice one important word, uncontrolled. This is usually not a permanent exclusion. Many patients improve their HbA1c within a few months.
This plan gives you complete control over your daily routine.
When the biology improves, the opportunity often returns. We optimize first, then we treat, because healthy biology produces better outcomes. The third exclusion is disease type. Prasad is designed primarily for osteoarthritis. It is not intended to control active rheumatoid arthritis, psoriatic arthritis, or other autoimmune inflammatory diseases. In these conditions, the inflammation begins in the immune system, not inside the knee itself. Unless the disease is controlled first, local biological treatment is unlikely to provide lasting benefit. These patients deserve excellent care, but that care begins with controlling the underlying autoimmune disease. The fourth exclusion is mechanical. Every step you take sends force through your knee. If those forces remain badly misdirected, they continue damaging the joint, no matter how good the biology is. Simply put, biology cannot overcome abnormal physics. Many patients with mild or moderate bow-leggedness can still undergo joint preservation, sometimes combined with a proximal fibular osteotomy. But severe deformity often requires a different reconstructive procedure. It may be a high tibial osteotomy. The mechanics must first be corrected before biology can succeed. The fifth category is one many patients don't expect: an actively inflamed knee. If your knee repeatedly fills with fluid, feels warm, looks swollen, or shows active synovitis, your knee is telling us something important. The inflammatory process is still highly active. Over the past few weeks, we have spoken about the inflammatory alarm inside the joint. When that alarm is still ringing loudly, the joint is still under biological attack. Trying to stimulate regeneration while destructive enzymes continue breaking down cartilage is unlikely to produce the best result. This does not mean you have reached the end of the road. It simply means your knee is not yet ready for regeneration. That is one of the reasons I have introduced A Kavach into my protocol. A Kavach acts as a biological shield. Its purpose is to help neutralize many of the destructive proteases or enzymes that continue damaging cartilage and sustaining inflammation. Think of it as creating a safer biological environment before we ask your own cells to begin repairing tissue. At MJRC, we follow one simple principle: inflammation first, regeneration second. First, we quieten the inflammatory storm. Then, once the knee is biologically ready, we move on to regenerative treatment with PRASAD. We don't abandon these patients, we prepare them, and that preparation often determines the quality of the outcome. The sixth exclusion is straightforward: active infection or active cancer. These are absolute contraindications. Patient safety always comes first. Until those conditions have been treated, PRASAD should not be performed. The final category is often the hardest to discuss. Some patients want the injection without the preparation, without improving their metabolic health, without dietary optimization, without the fasting protocol, without creating the biological environment needed for healing. I understand why. The injection feels like the treatment, but it isn't. The injection lasts one day. The biology begins weeks before that. Everything we ask you to do beforehand has one purpose: to improve the environment in which healing occurs. Preparation is not an optional extra. It is part of the treatment itself. If someone isn't ready to prepare, I would rather postpone treatment than knowingly reduce their chance of success. That isn't being strict, it's being responsible. If you followed this series from the beginning, you probably noticed one common message: successful regeneration begins long before the injection. It begins by understanding the disease, controlling inflammation, correcting what can be corrected, preparing the biology, and only then asking the joint to heal. PRASAD is not a miracle. It is not a shortcut. And it is certainly not for everyone. It is a carefully designed protocol for carefully selected patients, performed at the right time in the right biological environment. That is why we spend so much time evaluating the mechanics, the metabolism, the inflammatory environment, and your biological potential before recommending treatment. If you think you may be a suitable candidate, I recommend watching our complete PRASAD protocol video if you haven't already done so. Then gather your X-rays or MRI, your recent blood investigations, including your HbA1c, and contact us. Our team will carefully review your reports and arrange a consultation if appropriate. If PRASAD is right for you, we'll explain every step of the journey. If it isn't, we'll tell you that honestly and guide you towards the treatment that is. You can contact us at Good medicine isn't about offering every patient the same treatment. It's about offering every patient the treatment that gives them the greatest chance of success. I am Dr. A.K. Venkatachalam. Thank you for watching.